All right. Again, good evening. Hope everybody's had a good day. Thanks for joining us tonight for the last of the 4-part series, Medicare 101. We appreciate your hanging in there with us and your attendance. Tonight we are talking about other health insurance options that could potentially go with Medicare. And we got a lot of different options to talk about. Hopefully everybody received the email that I sent last night with the slides and the handouts for tonight's presentation. I will be pausing during the presentation, probably at the end of each section, to see if there are any questions. If anybody has any questions, you're welcome to either type it into the chat box, or you're welcome to unmute when I pause for questions to ask your questions. If anybody did not get the email, they will be available. The slides and the presentation handouts will be available on our website as of tomorrow. And you'll also get a link in your email tomorrow with a link to the recording of tonight's presentation. But again, if anybody has any questions, please feel free to type into the chat box at any time, and I will address questions at whenever I get a chance to pause. And then we will go on from there. Hopefully I won't keep you guys too long tonight, but we do have a lot of information to cover. So give me just 2 seconds and we'll get started. All right, so Part 4.4, Medicare 101, Medicare and other health insurance options. Again, I'm sure you guys are getting tired of seeing this, but I'm with the Area Agency on Aging, whose mission is to help develop programs and coordination assistance with other communities in our service area to help people remain independent for as long as possible in the community. I want to give a big thanks tonight to the Pikes Peak Library District, who has been a wonderful partner with us for these presentations for the last 5 years. Many people find out about these classes through the Pikes Peak Library District, so it's a wonderful partnership. It's worked very well, and we hope to continue that partnership for many years to come. And of course, I am with the SHIP program, or State Health Insurance Counseling Program, which is the federally funded program that's designed specifically and solely to provide unbiased information and education on all things related to Medicare to anybody who is either becoming eligible for Medicare, their families, their friends, their caregivers. We can help with any and all aspects of Medicare and or related coverages and benefits. And the SHIP program here in El Paso County through the AAA serves 9 counties of Colorado. SHIP program is available through a toll-free statewide number. And that number will route whoever calls in the state of Colorado to the SHIP office closest to them. Every county and every state in the entire country has access to a SHIP office to get this free, unbiased information and education. Quick review of what we've covered already. So we have already talked about Medicare A and B and eligibility to enroll in that, including benefits, coverage, costs. We've also talked about the other options for coverage on the open private market, which are Medigap or Medicare Advantage plans. And last week we talked about the prescription drug benefit, Medicare Part D, and how you can get that benefit either as a standalone plan or through an Advantage plan. Tonight, we're talking about pretty much any other option that might be available to someone who's becoming eligible for Medicare. and that includes employer coverage as well as Cobra, retiree coverage through an employer, military retirees, including those who are not retired but still have access to VA benefits, Medicaid, and the marketplace. So again, a lot of information to cover tonight. We're going to start with employer coverage. So these days, more and more people who are becoming eligible for Medicare based on age are still actively employed and still intend to remain actively employed for a little bit longer past age 65 or past eligibility. If you have employment and you have employer group health coverage, that coverage obviously is based on the active employment, can provide coverage for both yourself and or your family members, spouse or dependents. If you remember from previous presentations, to be actively employed with employer group coverage is the only excuse Social Security will accept for not enrolling in Medicare when you first become eligible, whether it's based on age or disability, and allows you to enroll once you are no longer employed without penalty. So again, it's the only reason that Social Security will accept for not enrolling in Medicare at first eligibility. And it does allow you to enroll at the end of employment. And it actually gives you an extended period of time to enroll in Medicare at the end of employment, a total of 8 months from the time your employment ends, to enroll in Medicare without penalty. The advantages of doing that, well, there are pros and cons as to whether or not you'd want to enroll in Medicare if you are still actively employed. And we've covered a little bit of that already. And there could be some disadvantages. The bottom line is employers cannot require you to take Medicare. That would be actually against the law. So they are required to allow you to continue with the employer coverage, regardless of whether or not you've become eligible for Medicare, as if nothing has changed. They cannot require or encourage or, want you. They cannot entice you to enroll in Medicare versus staying on the employer coverage. One of the options through an employer is Cobra coverage. And typically Cobra coverage is offered to employees who are no longer employed, are going to be laid off, perhaps going to be retiring. Cobra coverage is continuation coverage. So basically it's health insurance coverage that's offered to a previous employee or someone who's about to become a previous employee that continues the employer coverage for up to 18 and in some situations 36 months. It can also be offered if there's a reduction in work hours that make you no longer eligible to qualify for active employer coverage. It is available not only to cover the employee, but also can cover the spouse and or dependents. So in a situation where it would be allowed to cover the spouse and or dependents, it could be either because the employee has lost employment or has lost eligibility for active employer group coverage due to loss of hours. It could be because the employee becomes entitled and enrolls in Medicare, but wants to continue to cover his non-Medicare spouse and dependents through the employer coverage. It can be available to spouse or dependents if the employee and the spouse gets divorced. It can be available to the spouse if the employee dies, or if the dependent child is no longer going to be considered a dependent child. So there are many, many different situations where a Cobra benefit could be offered to someone or someone's spouse or dependents. When it comes to Medicare eligibility, whether or not you take advantage of Cobra coverage can be very, very tricky. And that is because Cobra coverage is not necessarily considered credible, meaning it's not going to be considered a good reason for not enrolling in Medicare. There are situations where you are allowed to have Cobra and Medicare. And then there are situations where you should not have Cobra and Medicare. So basically, if you are entitled to Medicare and then become entitled or elect Cobra, bottom line, you shouldn't probably elect Cobra. Once you're entitled and enrolled in Medicare, Medicare should be your primary coverage. Cobra is not going to be a good option because Cobra coverage will always typically become secondary to Medicare, and Cobra coverage is, because it's not considered credible, Cobra coverage technically should not even be a factor in your healthcare benefits. If you enroll in Cobra after you've become eligible for Medicare or enrolled in Medicare, and both insurances pay claims, or you pay premiums for both insurances, that can create a coordination of benefits issue. It can also create an issue where, and I've had this happen to clients in the past, they elected Cobra, they could have elected Medicare. Cobra found out like a year later that they could have elected Medicare, and Cobra stopped coverage and backdated all the claims that they had paid in that year and took all the money back from all the providers that they had paid in that year. And suddenly the patient, the beneficiary who should have enrolled in Medicare, was stuck with all of these bills that Cobra didn't pay. So the bottom line is, the best advice is, if you're eligible for Medicare, it is always better to take Medicare than it is to take Cobra. There are, of course, some exceptions to that rule, and don't forget that spouses and dependents who are younger, pre-Medicare age, are still eligible to stay in Cobra, and in some cases up to 36 months. But the Medicare beneficiary should probably usually take Cobra. Situations where that might be an exception, if, for example, you take a very expensive medication or a very specialized medication and your Cobra coverage covers that medication at 95%, and you look at the Medicare benefits and Medicare drug coverage for that same medication is not quite so good, that might be an advantage for you to stay in Cobra if your situation allows for it. The bottom line is, Cobra laws and rules can be very, very complex and complicated. Doesn't help that Cobra is managed by multiple government agencies. I did include in the email that I sent a handout of frequently asked questions about Cobra. But again, as SHIP counselors, we are always able and happy to talk to somebody who has questions about Cobra and whether or not that's a good option for them and in what situations that might work best for them at any time. So we're always happy to talk to people who have questions about Cobra anytime in the future. And I do strongly encourage people to take advantage of getting some advice before actually enrolling in Cobra if you are eligible or becoming eligible for Medicare. So I will pause real quick to see if there are any questions. Again, you can unmute and simply ask your question, or you can type it into the chat box. So I've got a couple of questions. It looks like in the chat, does every state have a SHIP office? Again, every county of every state in this country has access to a SHIP office, whether it be by toll-free number within each state or by actually having an office location close to them. But yes, every county and every state has access, at the very least by phone, to a local SHIP office in their area. And then it looks like I've got a comment, getting hundreds of offers from AARP, USA, Mutual of Omaha, Kaiser, for supplement insurance and others. How are these programs an advantage to Medicare A and B and D? So if you are becoming eligible for Medicare, if any of you are approaching age 65, you are probably being inundated with junk mail. You are getting mail from every company that has ever thought about buying your statistical information so that they know when someone is getting close to age 65, and they're going to start mailing you applications, they're going to start mailing you solicitations to buy their insurance. You're probably getting emails. You're probably getting phone calls. Shoot, you might even get someone knocking at your door. And unfortunately, there's not much we can do about that because everybody and his brother probably knows that you are getting ready to turn 65 and become eligible for Medicare. The point of this presentation series is to help you decide what kind of coverage is going to work best for you. It's to help you decide what kind of coverage is going to be most beneficial, most cost-effective, most comfortable for you for the long haul, whether it be an Advantage plan or original Medicare with a supplement, or even just Medicare A and B and D with no other kind of insurance. All of those are options. And again, certainly if anybody's still unsure of what direction they're thinking about going in, please give us a call. We're happy to chat with you one-on-one and look at your specific situation and see what we can help you determine as far as what's going to work best for you. So that's kind of probably a vague answer, but there's not really one good solid concrete answer to how those programs are an advantage to A, B, and D. Looks like I got another question about a TV commercial where they get the $144 back every month from Medicare that goes to their Social Security. So again, inundated with junk mail. Forgot to mention the TV commercials because the TV commercials are kind of out of control as well. I can't turn on any station without getting a Medicare related commercial at some point. There are some plans available, and they are going to be Advantage plans that may be able to provide some reimbursement in part or in whole of the Medicare Part B premium. Most of the time, those plans are going to be for specific populations or demographics of people. Not every plan is going to do that, and not everybody's going to be eligible for that kind of coverage or that kind of benefit. So you would really have to call the plan directly to get more information. You're welcome to call us. We'll provide more information about the plans that offer that benefit. There are very, very few plans that do that right now, regardless of what the commercials imply. There might be one in Colorado Springs area or El Paso County. And I think there's one that doesn't offer drug coverage that is usually marketed towards retired military that might provide, I think, a partial credit of the Part B premium. But again, give us a call. Let us provide more information before you call an insurance broker or even call the 800 number on the TV, because they're going to simply try and sell you something, and we're happy to provide you with more information before you make that call. Then I'll take one more question here before we move on. Is it true that Medicare usually covers only medically necessary but not preventive, like an annual routine physical exam and annual blood tests to check high cholesterol, etc., would not be covered through Medicare? So the answer is yes to both. Medicare will pay for any medically necessary service you need of any kind for any reason without hesitation. But the key criteria for Medicare to pay for something is medical necessity. Whose responsibility is it to say what's medically necessary? Well, it's typically your doctor's responsibility to tell Medicare that whatever service that doctor is trying to provide to you is medically necessary. And for the most part, Medicare typically takes their word for it. As far as preventive, well, in week one, we kind of covered what Medicare pays for as a preventive service. Medicare has jumped on the preventive benefit bandwagon, covers many preventive services, adds more and more services to that list of what's covered as a preventive service every year. However, one of the things they will not and do not cover are routine annual physicals. So if you are used to getting a routine annual physical where you go in, the doctor hooks you up to the treadmill with all the things stuck to you, he takes blood work, that is not a benefit of Medicare. That is very correct. What Medicare pays for instead of that routine physical is that Welcome to Medicare wellness or preventive visit and the annual wellness visit, which again are visits. They're conversations, in-depth conversations with your provider. If during the course of a preventive visit with your provider, the doctor determines that perhaps you need to be tested for something, then the doctor can order a test, and that would be paid for as a medically necessary test based on that conversation by the doctor. But that probably eliminates the free preventive visit if it turns into a medically necessary medical appointment. So anybody who is used to getting that routine physical, honestly, no, you're not going to get that covered anymore. Some Advantage plans may suggest that they offer routine physicals, but quite honestly, it's probably more likely the Medicare preventive visit. Again, it's the doctor's responsibility. It's your medical provider's responsibility. The entity that's going to be billing Medicare for a service that is responsible for telling Medicare that that service is medically necessary. If for any reason down the road you ever run into a situation where the doctor is suggesting you get a medical service, but you're not really sure that it makes sense for you to get that service, my best advice is ask the doctor, is Medicare going to pay for that? If the provider ever suggests that no, Medicare is probably not going to pay for that, what they're telling you truly is that it's not going to be medically necessary. And you should really double, think twice before you go ahead and have that service performed. Hopefully that answered that question. Whether or not Medicare in the future will ever cover preventive services, as far as that routine annual physical, who knows? Medicare has actually made some turnaround on what they will and will not cover in the recent past, in the last few years. It could be on the table. I mean, they're considering covering dental and routine vision, so you never know. But as of right now, no routine physicals. Okay, so let's move on. So we talked about coverage through active employment. If you are retiring and you have the ability to access retirement health benefits through that employer or through any past employer, that is certainly something that you should take into consideration, and so certainly look at what kind of coverage is being offered to you at what kind of costs. Many times an employer retirement benefit can be very, very beneficial to you if it's designed to coordinate with Medicare. The key to employer retirement benefits, though, is that they can vary significantly from employer to employer. Eligibility is always going to be determined by the employer. Not every employer is going to offer retirement health coverage. And what that retirement health coverage looks like can vary quite a bit from one employer to the other. So types of coverage that can be offered as a retirement health benefit for retirees with Medicare. Well, I know many employees or employers can provide customized plans that look very similar to Medigap's or Medicare Advantage plans, but they're customized, meaning they're enhanced usually because the employer is chosen to provide enhanced benefits with that kind of coverage specifically for their Medicare retirees. I have seen employers who offer just standardized Medigap or Advantage Plan benefits. Usually they will contract with a third-party company. That third party is basically going to consist of a company of agents and brokers who are able to sell multiple different kinds of companies and multiple different kinds of plans, but it's going to be a limited number or a handful of companies and plans that they will offer to provide to you. And as long as you go through this third party based on your retirement employer coverage, the employer may pick up some of that cost. I've also seen it where employers simply offer a cash subsidy, either an annual lump sum amount that you can use however you choose, or they will offer a monthly subsidy to the cost of health benefits. I've seen it where your employer coverage that you had when you were actively employed continues, does not change, but it simply becomes secondary to Medicare and may or may not coordinate with Medicare. I've seen it where the coverage is paid for at 100% by the employer. I've seen it where the coverage is paid at 0% by the employer. And I've seen it as a combination of any and all of those options. So when it comes to retiree coverage that is offered through a past employer, the bottom line is it is totally up to the employer as to what kind of coverage will be offered and what it would look like, and whether or not that's going to be coverage that's an advantage to you is something that you would really want to take into consideration and really review what's being offered to you to make sure that you understand the benefits and the costs and the coverage. You'd also want to make sure that any benefit that's being offered by the employer, if it includes a drug benefit, you'd want to make sure that that drug benefit is considered credible, meaning, again, that it's as good or better than what Medicare would offer. If an employer, as part of retirement benefit, and even if you're actively employed and eligible for Medicare, employers are by federal regulation required to provide notification every year as to whether or not any drug benefit that they offer to you is considered credible or as good as or better than what Medicare Part D can provide. Sometimes it is, sometimes it isn't. Sometimes the health benefits will be very, very good, but the drug benefit will not be very good. Sometimes the drug benefit is better than what Medicare Part D can offer. And sometimes it's significantly better. All of those things should factor into whether or not that is a good choice for you if that's something that is being offered to you. Things that you'd want to take in consideration when you're looking at these kinds of options, obviously how much it's going to cost you to have the employer coverage versus what it might cost you to go out and get a supplement or an advantage plan, and what kind of out-of-pocket costs that option might have in the form of deductibles or co-pays, whether or not it has a maximum out-of-pocket, meaning, do you have to spend $12,000 before the plan starts picking up, 50% of your medical expenses. So all of those things are things that you'd want to take into consideration and perhaps compare to what the same costs would be for the same services if you went with a Medigap and a Part D, or if you went with an Advantage plan. Other things to consider might be, if the employer is offering an HMO type coverage, but you plan on traveling after retirement and you're going to be going all over the place, maybe an HMO type coverage may not be your best option because you will not be in the service area for much time. Maybe you need to take into consideration whether or not the coverage being offered by the employer has a network that you have to worry about in any regards. For example, federal retirees, many of the plan options that are offered to federal retirees do require that not only do you go to a Medicare contracted provider, but that provider should also take Anthem Blue Cross. So you'd have to make sure that the provider is in both networks for that insurance to maximize benefits. So again, a lot of different moving parts and a lot of things to take into consideration when you're looking at retirement benefits that are being offered. Again, if you're not sure what's being offered, if you need some advice on what the options look like and how they compare to Medicare supplements or Medicare Advantage plans, give us a call. We're happy to talk to you about your specific options and how that may or may not work for you and what those costs would look like. That's pretty much kind of what we do, and we're happy to do it. So again, the bottom line is, when in doubt, ask your HR person what's being offered, when it's being offered, when it's available for you to enroll in. And when you have more information about the specifics of the offering that will be available to you, give us a call and let's talk about it. So I will pause again to see if there are any other questions about any of that. Looks like I have one question. If I keep my spouse on my employee plan, when that employment ends, is there a gap between the end of employment coverage and the start of Medicare coverage? Not necessarily. So the benefit of delayed enrollment into Medicare in favor of active employment with coverage is that when you decide that you are ready to retire or stop working, as soon as you know that retirement date or that end date for your employment, as soon as you know that date, you can turn around, contact Social Security, and arrange to have Medicare coordinated so that, you know, when your employer coverage ends, Medicare can start the next day so that there is no gap in coverage, so that you're not in a situation where you have a gap of insurance and have no coverage. And again, you can enroll in Medicare anytime while you're actively employed past your initial eligibility. And once that employment ends, you have an additional 8 months to enroll in Medicare without penalty. And at any time during that time frame, when you know that you're going to want Medicare to start or when your employer coverage ends, you contact Social Security to enroll in Medicare and you tell them when you want it to start so that you have no gaps in coverage. Same thing with any other coverage option that you're going to go with, Advantage plan, supplement, Part D plan. When you know you have an end date for employment, when you enroll in Medicare and you have that Medicare ID number, you can go ahead and start contacting the other kinds of insurance that you're interested in and schedule that or coordinate that to all start at the same time Medicare starts, so that you have full coverage with Medicare and whatever other option you wanted to go with the day after your employer coverage ends. So absolutely, there shouldn't have to be a gap. Another coverage or another question is, can younger spouse go on Medicare with me, or do I have to continue FEHB for her? Okay. So Medicare eligibility is based on an individual's eligibility. If someone is younger than 65, such as a spouse, they are not going to be eligible for Medicare until they turn 65. If they are currently covered and in this situation under FEHB, which is the Federal Employee Health Benefits, absolutely, you would be able to keep that spouse on the Federal Employee Health Benefits. That benefit would stay the same for them. And as the Medicare beneficiary who enrolls in Medicare, you can also stay on the FEHB benefit, but that FEHB benefit would become secondary to Medicare, and it would actually coordinate with Medicare to pick up the costs that Medicare left over, such as deductibles and co-insurances. So the coverage would basically change for the Medicare beneficiary, but stay the same for the spouse. But either way, it's going to be at the same cost with the same company until the next open enrollment period. I believe that also creates, if an employee with FEHB becomes eligible and enrolls in Medicare, it should also create a life change event that would allow you to potentially change to a different insurance coverage option through FEHB if you chose to do so. So hopefully that answered your question. For those who have para, I know I get a lot of para retirees who come talk to us. Para also offers some very wonderful retirement options for retirees with Medicare that are specifically designed to coordinate with Medicare. They are supplement and advantage plan styled options that are enhanced. Cost does go down for coverage through Paracare once you become eligible for Medicare. But they do offer very good options. FEHB is very good options. So yeah, again, absolutely would be able to keep spouses on those kinds of options as pre-Medicare, and the employee retiree can go on the options as with Medicare. All right, next. If there's no other questions, we'll move on. All right, so now we're going to talk about military retirees and or military veterans. We'll talk about retirees first. So if you are a military retiree, you're probably most likely, unless you have employer coverage that you chose to go with instead, covered under TRICARE, TRICARE Prime, TRICARE Standard. That is going to be your pre-Medicare option. However, when you become eligible for Medicare, TRICARE does change and will automatically convert to TRICARE for Life. TRICARE for Life is the health benefit that was written into law in 2004, I believe, or 2006. I think 2004. It was a benefit that the government had promised retirees, which was lifetime health care. It took many, many years for that law to come into being. And now that it is a law, it is absolutely something that retirees can take advantage of. In order to be eligible for TRICARE for Life, you do have to be a retiree with 20 plus years in the service and be honorably discharged. The key to TRICARE for Life, you are absolutely required to enroll in Medicare when you become eligible. So you're required to enroll in Medicare A and B. On the other hand, TRICARE for Life with Medicare A and B is probably quite literally some of the best coverage that anybody can have in this country today. So Medicare A and B and TRICARE for Life would be all you ever needed. It provides drug coverage that's better than what Part D offers. You would not need any supplements. You would not need any advantage plans. Medicare and TRICARE for Life are good anywhere in this country with any provider that accepts Medicare. And TRICARE acts very much like a Medicare supplement and picks up any deductible and any co-insurance that Medicare left over after Medicare A and B paid their part first, period. So again, Medicare and TRICARE for Life, literally some of the best coverage available in this country today. You do have to enroll in Medicare, and you'd want to contact your local DEERS office to let them know when you are enrolled in Medicare so that they can get that Medicare information and your TRICARE Standard or Prime would convert to TRICARE for Life. If you do not enroll in Medicare when you become eligible, you do risk losing TRICARE coverage altogether. So they are very serious that you are required to enroll in Medicare when you become eligible for Medicare if you're a retired military using TRICARE. And if you want more information, I've provided the website at the bottom of the slide. Actually, it does have some really, really good information on that website. If you are not retired, but you are a veteran of the military and have access to the VA system, that is almost as good, not quite, and it works a little bit differently. So eligibility for use of veterans benefits is determined by the VA. It can be based on disability, it can be based on income, it can be based on medical need. So, and there are many, many different types of assistance that you can get through VA, many types of benefits that you can access. It typically will give you access to use any of the VA medical facilities anywhere in the country. To use VA, you're not required to enroll in Medicare because, quite honestly, VA benefits are not considered health insurance. It's considered a military service benefit, but it is not really considered health insurance, even though it's primarily going to be used for health issues. So enrollment into Medicare is not required. It is typically something that I encourage, but I do get a lot of veterans call up and ask me whether or not they should enroll in Part B if they use VA primarily for all their services or not. So my answer to that is usually, again, it's not something you have to do, but it can be useful to have Medicare A and B and go ahead and enroll in Part B and pay for Part B. We are in an area of the country, in an area of Colorado, where we are surrounded by military bases. We are very, very fortunate that access to medical care for our veterans is pretty easy to come by. Not always, even in an area surrounded by 5 military bases, but usually. However, that's not the case in every state. That's not the case in every area of the state. And sometimes accessing a VA medical facility can be problematic for some people. If you use the VA and you have Medicare A and B, what that gives you is the benefit of being able to go anywhere and use Medicare for any medical need you have ever, and still have access to VA for anything you needed or wanted to use the VA system for. So it gives you more flexibility on where you can get services. VA does tend to provide services that are military-related medical needs in some situations, whereas Medicare doesn't care. You have a medical need, Medicare will pay for it. Medicare facilities and providers can be easier to access, can be quicker to access. If you have access to VA services, it does provide access to long-term care services and supports. So that is another big benefit for veterans, to provide long-term care either in the home or in a facility. So again, it's totally up to the veteran as to whether or not they go ahead and enroll in Medicare Part B, whether or not they want to pay that Part B premium. I do encourage it most of the time, but it is totally up to that person as to whether or not they feel it's going to be a benefit. If you delay enrollment or choose not to enroll in Medicare when you first become eligible because you use the VA, you would be allowed to enroll in Medicare any year down the road during the annual enrollment period, the general enrollment period. But you will pay a premium, you'll pay a penalty on that premium for not having enrolled sooner, because it's not considered credible coverage, it's not considered an acceptable reason for not enrolling in Medicare. Only active employment is. So that is something to keep in mind, that you may feel you don't need Part B now, but you may feel differently in the future. You would be allowed to enroll in Part B in the future, but you will pay a penalty to do so. Any questions about any of that?
You've got a couple questions there in your chat.
So let me look at these questions in the chat. if I am still working full-time and getting health insurance and sign up for Medicare at 65, is Medicare primary or secondary? So if you are still actively employed with employer group coverage, but you go ahead and enroll in Medicare A and B, or even if you just enroll in Part A, typically the employer coverage is going to be primary. The exception to that rule is if the employer is less than 20 employees. If the employer has less than 20 employees, then Medicare would probably be primary to the employer coverage. Again, you'd want to take into consideration if you enroll in both the health coverage through the employer and Medicare A and B, you'd want to take into consideration the costs of paying premiums for both. If you enroll in just Part A because it's at no cost, you've earned that premium-free Part A. Keep in mind that, again, the employer coverage is typically going to be primary for Part A services, which are going to be those inpatient hospital services. Medicare Part A would be secondary to any employer coverage. There could be advantages to that if your employer coverage has, a high deductible that you would have to meet, like a $6,000 deductible if you had a hospitalization. If you had Part A in place, your employer coverage would pay first, apply the $6,000 deductible. Medicare Part A could be billed secondary. They would apply their $1,400 deductible and probably pay the difference between your $6,000 deductible and what they paid. So that could be a benefit. It may not be a benefit, depends on your current employer coverage and how good or not good that is and what those costs look like. But again, probably secondary to the employer coverage unless there's 20 employees in the company. Another question is, I'm retired military. My wife is older and is also eligible for TRICARE for life as my spouse. Will she need to enroll in Medicare when she turns 65 in order to protect her TRICARE, even though she will still be working and have her employer health plan? Yes. Unfortunately, again, because she's eligible to access the TRICARE benefits, when she becomes eligible for Medicare, her TRICARE for life would need to kick in. But keep in mind, that's if she enrolls in Medicare. If she continues to be actively employed with employer coverage when she becomes eligible for Medicare, she doesn't have to necessarily enroll in Medicare. Well, no, she would, because it's TRICARE. My bad. Yeah, she'd be required to enroll in Medicare, bottom line. So it may or may not be an advantage for her to keep the employer coverage. And she should look at whether or not she could drop that employer coverage, probably, in favor of Medicare and TRICARE for life. Because again, Medicare and TRICARE for life is going to be some of the best coverage in the country, certainly have less out of pocket than most employer plans, may have smaller costs than employer plans and premiums. But yeah, I'm pretty sure she'd be required to enroll in Medicare when she becomes eligible for Medicare if she wants to continue TRICARE coverage at all. Any other questions? Okay. Make sure I've covered all the questions real quick and then we'll move on. So quick question, could the employer coverage be third? Oh, to Medicare and TRICARE? No, because the employer coverage would have to be primary even in that scenario. So if she kept her employer coverage and had Medicare and had TRICARE, the employer coverage, as long as it's 20 plus employees, the employer coverage would be primary, Medicare would be secondary, TRICARE would be third, is how that would work. All right, if there's no other questions, we will move on. Might actually get done on time tonight. So one of the last benefits we're going to talk about is the potential of qualifying for Medicaid to go with Medicare. So Medicaid is a state-run program. It's a needs-based program, so it's primarily going to be available to people who have limited availability for health insurance, have limited income and resources. It's a state-run program, so Medicaid programs can vary from state to state. It is funded by federal and state dollars, but it is managed by the state and directed by the state. So it does vary from state to state. Health First Colorado, so Colorado Medicaid was recently renamed a couple of years ago to Health First Colorado. What most people don't realize is there are about 45 different kinds of Medicaid in Colorado alone. 45 different kinds. So Medicaid is not Medicaid is not Medicaid. Each one of those 45 different kinds of Medicaid has different eligibility criteria to qualify for that benefit. One of the most commonly used benefits of Medicaid, of course, is provided to us through the Affordable Care Act, which is what we call MAGI Medicaid or expanded Medicaid benefits. Expanded Medicaid benefit eligibility was something that came into being in about 2014 when the Affordable Care Act came into being. It is primarily going to be a benefit available to people who are under 65, so between the ages of 18 and 64, basically. It is going to be based on income, so it's going to be based on financial need, but it only looks at income. So anybody can qualify if their monthly income is within the limit for qualifying, even if they have $100,000 sitting in the bank as an asset. So again, expanded Medicaid, it allowed a lot more people to be eligible for that healthcare benefit, which was very beneficial for many, many people. And it's very, very, very generous criteria to qualify. And it's really actually very good benefits to have Medicaid. But again, varies from state to state. I have a lot of people who choose to move to Colorado when they retire or after they have Medicare, if they've been on a Medicaid program in the state where they came from, and they come to Colorado and expect to qualify for that same program in the state of Colorado. And sometimes they simply do not. Unfortunately, that's not anything that anybody can do anything about. But it is usually strongly encouraged that you investigate what benefits look like and what benefits are offered if you intend to move from one state to another. The other thing to take into consideration is if you are eligible for Medicare, and typically if you are over the age of 60 or 65, eligibility for Medicaid will also start looking at assets as part of the eligibility criteria. And Medicaid, if you are eligible and become enrolled in Medicaid, will always be the payer of last resort. So that question I answered just a minute ago about, who's on first and who's on second, regardless of any other coverage option you might have available to you or be enrolled in, Medicaid will always be the last payer. So if you have Medicare and TRICARE and Medicaid, Medicare is first, TRICARE second, Medicaid is always last, with some exceptions. If there's a benefit that Medicaid pays for that Medicare and TRICARE don't, or Medicare and other coverage does not, then Medicaid would be the first payer. And that would be more commonly found in programs for people with Medicare, people over 60, particularly for long-term care programs. So there are several programs available under Medicaid specifically for people over 65, specifically for people with Medicare. And we've already talked about this first program, Medicare Savings. It is specifically for people who enroll in Medicare. It specifically helps cover the costs of Medicare, primarily the Medicare Part B premium. Medicare Savings Program technically is not Medicaid. It's not a state program. It is a federal program. So the eligibility is as a benefit to help people pay their Medicare is federally mandated, and it's available to anybody and everybody across the country. But it's typically applied for through the local Medicaid office in whatever area you're in. But again, it will only cover Medicare-related expenses, such as the Part B premium. Other programs that are specific to those who are either aged in or perhaps on disability and receiving disability, Social Security disability, or SSI. A couple of programs can provide some financial support. The Old Age Pension, or OAP program, is a financial benefit. It's a cash benefit, a monthly cash benefit. However, to qualify, income would have to be very, very low or non-existent, because it basically will supplement or create an income of up to just over $800 a month, which is below poverty level, or it'll supplement SSI benefits, which is Social Security cash benefit assistance for those who don't have eligibility into the retirement Social Security or disability Social Security because they have not enough work history. So it can be a cash benefit through OAP. Other programs that are common are going to be the long-term care programs. Excuse me. Home and community-based services is a long-term care program that helps people stay at home. So it provides some in-home assistance, in-home services, so that it allows people to stay at home versus going to an assisted living or a nursing facility. But the long-term care Medicaid can cover that as well. And it covers the cost of room and board in an assisted living or nursing facility. Again, eligibility criteria is going to primarily be based on finances for any Medicaid program. Long-term care programs will also require some physical need criteria, meaning you'll actually have to have a need for assistance to qualify for those benefits. Anybody who is interested in getting more information about any Medicaid program, give us a call. Also, we do produce the booklet every year that's distributed across the state. It's called the Colorado Adult Medicaid and Veterans Benefits Program. It kind of describes the benefits. It describes the eligibility criteria. It describes the application process. Very, very handy and useful to have if this is something you are looking at either needing or needing information about. We also help with Medicaid applications for any of those programs. So we are happy to answer any questions about any Medicaid programs, eligibility criteria, etc. And we can also help complete applications with you as well. So that is Medicaid in a nutshell. Any questions about that? No questions, no questions. Again, we do help with any and all of these programs and applications. So if anybody has questions or wants more information down the road, give us a call, shoot me an email. Happy to talk to you. All right, I'm not seeing any questions in the chat. Not hearing any questions, so let's move on to the last topic we're going to talk about, which is the marketplace coverage. Some people may currently be insured through the marketplace, also known as Obamacare. It is coverage that is typically available for people who are not eligible for employer benefits or are not insured in any other way. I can tell you that the marketplace coverage was a a massive benefit for my mom, who had to retire because of health issues, lost her employer coverage, would have been uninsurable for 2 years before her Medicare kicked in, had it not been for marketplace coverage in the Affordable Care Act. She had been diagnosed with cancer. It would have been devastating had she not had access to insurance. So I'm pro marketplace coverage. In the state of Colorado, we chose to manage our own marketplace. Most states did not. So most states, their marketplace is managed by the feds. Colorado manages our own. Whether or not we're doing a very good job of it, it's hard to say. I know we've had some ups and downs and some bumps in the road, but for the most part, it works fairly well. Current presidential administration has extended enrollment period to enroll in marketplace coverage for this year, I believe through mid-May. So anybody who perhaps missed enrollment or couldn't enroll for whatever reason during the typical enrollment period, which ended January 15th, that enrollment period has been extended through mid-May. And basically it's private insurance. It's private insurance. You buy from private insurers. You can go onto the website, Connect for Health Colorado, and look at the costs of the different plan options that are available to choose from, compare the premiums, the deductibles, the copays. You can look to see if you qualify for tax credits or premium subsidies. So one of the best things about the marketplace is that if you qualify, again, based on income, adjusted gross income, you may qualify to get reduced premiums or tax credits on the cost of those premiums at the end of the year. So it can be very affordable if you qualify. And they do have a tool on that website that lets you just put in, without having to create an account, lets you put in your income and resources and family size, et cetera. And it will tell you in a general way whether or not you may qualify for any tax credits. It will also tell you if you may qualify for Medicaid, for the expanded Medicaid benefit based on your income and household size. So can be very, very useful tool. Certainly something that if you don't have any of the other options we may have talked about tonight, could be something that is very useful and beneficial for you. Could be definitely worth exploring and taking a look at those options. But you are limited to certain timeframes to enroll in this kind of coverage, typically December 15th through January 15th, I believe. But enrollment period has been extended for this year due to COVID. And certainly something that, again, if you have none of the other options that we've talked about, might be something that you look at. However, once you become eligible for Medicare, eligibility for marketplace can change. Technically, you can have Medicare and have a marketplace plan, but it's usually going to be under limited circumstances, situations. So if you are entitled to Medicare Part A at no cost, and you have marketplace coverage, if you keep both, you would lose any tax credits or premium subsidies you may have had prior to Medicare. And it's typically not going to coordinate with Medicare. If you already have Medicare and someone tries to sell you a marketplace benefit or marketplace plan, that's illegal. Because once you are enrolled in Medicare, you are honestly not eligible to be enrolled in marketplace coverage. So the only way you can probably stay enrolled in marketplace when you have Medicare is if you choose not to enroll in Medicare, or you have to pay a premium for Medicare Part A. You're not eligible for free Part A. It would allow you to drop Part A and have marketplace coverage instead, because you had to pay for Medicare. you would be able to keep Medicare and Marketplace, but you would not be allowed to collect Social Security at the same time. And Marketplace coverage is not going to be considered creditable for late enrollment into Medicare. So if you are eligible for Medicare premium-free Part A, and you choose not to enroll and you stay in the Marketplace coverage, and then find out later you should have enrolled in Medicare, there's not any waiving of late penalties. You have to wait for the general enrollment period. And there could be a time frame when you have a gap in coverage because Marketplace coverage may end. What you can do in the Marketplace if you have Medicare is you can go in there and get dental benefits. So the Marketplace does offer dental plans or standalone dental coverage that might be worth looking at, simply because it would be an affordable way to get dental coverage with Medicare, since Medicare doesn't offer it itself. So that is something that you could do without any restrictions. But the bottom line is, again, Marketplace laws and rules can be complicated. And what you decide to do with the Marketplace coverage you have when you become eligible for Medicare can greatly affect your eligibility or your benefits down the road. Give us a call, come talk to us. I included a Marketplace frequently asked questions, Marketplace and Medicare frequently asked questions handout in the email that I sent you last night. So hopefully that will answer some questions. But the bottom line is, as a general rule of thumb, if you become eligible for Medicare and you have Marketplace coverage, you need to disenroll from the Marketplace coverage in favor of Medicare. It will probably save you a lot of money and honestly be better coverage to have Medicare versus the Marketplace. And I think that's all of the topics. I know I covered just some very general information about all of those, but you know, every situation is different and every person's situation is differently affected by any and all of these options. So, you know, without sitting down with someone one-on-one, it's very difficult to go into too much detail. But again, that's the benefit of having access to a SHIP counselor. That's what we're here for. We're happy to talk to you one-on-one about your situation and your options to make sure that you make the best decisions. Contact information, always welcome to shoot me an email. You're always welcome to give us a call. We have 5 SHIP counselors ready and waiting to talk to you, and happy to do it. So I will look at, let's see if we have any last minute questions, and then I will let you guys go early for a change. Have the Medicare and You 2021 handbooks. Our handbook, does the Colorado version have Colorado on the front cover or some other obvious place? Not really. It does usually say Colorado on the back of the booklet. And the way you know the difference between the national version of the Medicare and You and the Colorado specific version of the Medicare and You is that the Colorado specific version will include at the very, very back of that booklet a list of all the Medicare Advantage plans and drug plans available in Colorado only. The national version of that booklet, or the one that you can download from the Medicare and You website, is not going to have that information. You can call 1-800-Medicare and request that they send you a Colorado specific booklet. Usually takes 4 to 6 weeks to get, sometimes less. I ordered as many as they would allow me to order, but for the 3rd year in a row, I never received them. So your best bet is to call 1-800-Medicare if you want a specific Colorado and You specific. Next question, does the window of a few months to enroll in Medicare at age 65 conflict and no longer apply if current enrollment in the Marketplace? No. When you are becoming eligible for Medicare, that 7-month window of initial eligibility to enroll The 3 months before your 65th birthday, the month of, and 3 months after is still there, still applies. When you're getting close to becoming eligible for Medicare, you know you're going to enroll in Medicare to be effective the month of your birthday. You need to contact your marketplace coverage within 30 days prior to that and let them know that you're becoming eligible for Medicare so that that coverage can end at the day before Medicare coverage starts. So it will end at midnight at the end of the month. Medicare will start at 12:01 the next day. So no, it does still apply and it does not conflict. It would coincide. Oh, previous page. Thank you. Thank you again. Thank you all for attending. We really appreciate you joining us and hanging in there for all 4 of these weeks of information. Hopefully you guys found this format a little easier to digest. I know it is a lot of information and I tend to give you more information than you wanted usually, but I think it's that important that you have as much information as possible so that you can make the best decisions moving forward. That's what I'm here for. That's what we do. And I really do think it's an important thing to do. I think it's important for you to know what you're getting into and have a clear understanding of those benefits. So again, anybody has any questions after this presentation is done, shoot me an email, give us a call. We're happy to visit with you. If anybody needs the handouts or a link.
Thank you so much.
You're welcome. Thank you. I hope everybody has a good night. Thanks for joining us. We will be doing this four-week series again, not next month, but in April. And in between then, I will be doing a lunch and learn through the Pikes Peak Library District. I think my first one is on Cobra specifically. But thank you. Please tell all your friends that we are happy to have them join us for this presentation and they are welcome to register. I hope everybody has a great night. Thanks again for joining us. And on that note, I don't see any other questions, so I will let you guys go and enjoy the rest of your evening. Oh, quick question, what is the lunch and learn? So lunch and learn that we're going to be doing with the library next month, and in between the months I do the one-on-ones, is going to literally be at lunch. It'll be a 1-hour presentation where I do a short presentations on a specific topic. And I think the first one will be about Cobra specifically. So I may be able to get into a little more detail. And then the rest of that hour, it'll be a 15-20 minute presentation. The rest of the hour will be available for questions and answers. Jessica has put up in the chat box the link to register for that event and any of the future events. I know I'll have one specifically for retirement benefits or employer coverage. One will be for Part D and open enrollment. So please feel free to join us. We'd love to have you. And I hope everybody has a good evening. With no other questions, thanks again, and hopefully we'll hear from you if there's anything we can help you with in the future. You guys take care. I'll hang out for just a few more minutes in case anybody has anything they want to chat.